It seems like every week more and more dentists are coming to me totally confused about this thing called the EHR incentive program, where providers and practices can get money from the federal government. So I thought it was about time that I sit down and actually put together a little webinar to kind of talk about the facts and the myths behind the EHR incentive and the Meaningful Use program. Now here's the thing. Let's get this clear right off the bat. There is technically no mandate to start using electronic health records in dentistry. However, the government has put a heck of a carrot out, what I call the gold rush. Over the last few years, they've actually been paying providers, in some cases a lot of money, to actually purchase, implement, and use electronic health record technology. The problem is the physicians have been taking advantage of this program for a number of years, but where are the dentists? There's a lot of money left on the table by dentists. So hopefully, with this webinar, I'll tell you how you can actually obtain the money for the EHR Incentive Meaningful Use program, because we don't want to be left behind. The physicians in the medical world is getting all the incentives, and dentists really aren't getting their fair share at this point. So the first thing we really want to think about is what you need to know. That's really what this webinar is based on. So the first question we'll talk about is really, what is this EHR incentive program? We'll go over how you can actually determine if you are eligible, if you or your practice are eligible. Part of being eligible is using a certified EHR, so we will talk about what constitutes a certified EHR. Not every dental software vendor is certified. When people call me up, they ask me a lot about people that have been calling them, banging their doors down, talking about how they can help them get the money. So we'll talk about that. We'll talk about whether you need a consultant or not and what really makes a good consultant. And finally, I want to talk about certified technology itself. Why a certified electronic health record is better for your practice. So we'll go over those during this webinar. Now the first one is really the crux of this whole thing. And a lot of people, in fact it's really interesting when I talk to a lot of dentists, they aren't even aware this program is there. So what is the EHR incentive program? Well, let's kind of go to a little bit of history. I personally have been involved with this program from the beginning, about 5 years ago or so. And really what it came out of, the federal government and state governments really wanted to move healthcare to using electronic health records. And the problem at that point was that it was pretty expensive. So a lot of the docs were pushing back, a lot of the practices were pushing back, saying, you know what, we really don't have money for this. Give us some justification. Give us something more than just that it's better for us. So the government came upon this idea of an EHR incentive program that will help subsidize the cost of electronic health records. And again, like I said, I haven't been involved with this for a number of years, and I remember some of the committees in the early days talking about the pros and cons of this. So this has been around since about 2010, 2011. Where some of the confusion is, there's actually two programs. The first one is based off of Medicare. And as you can see, it started in 2011 and actually ended this past year. So realistically, the way this worked was if a physician or a practice was eligible for a certain amount of Medicare, then they would be able to get Medicare-based incentive money from the federal government. And again, this started in 2011 and basically ended in 2015, so that's over with. Okay. However, you see the red here. What's really interesting to note is if you do accept Medicare, if you do not have a certified EHR by this year, then what will happen is Medicare will start docking you money, 1% per year, up to 5%. So again, the incentive of the $44,000 is over at this point. However, be aware that if you do take Medicare, there is a potential that you will get docked some of your Medicare money over the next years to come if you do not have a certified electronic health record technology. Okay, so let's put this aside, and let's really talk about what's most relevant to dentists. And this is the program which is funded under Medicaid. And again, this started in 2011, but the interesting thing is that it goes through 2021. Okay, so as long as you start the program by 2016, which means you should start thinking about getting your certified EHR now, because it takes a while to make that decision. As long as you start in the program year of 2016, you have up to $63,750 that you can obtain from the federal government. And this is actually technically not the federal government on the Medicaid program, but this is through your state Medicaid. And the way it shakes out is the first year, each eligible provider can get $21,250, and then $8,500 for the next 5 years afterwards. So as you can see, they've actually paid out Medicaid over $9 billion in provider payments. And you know, as I alluded to before, most of this money has gone to physicians. So if you're eligible, we really need to get dentists in the fore here so they can take advantage of the money. Let's talk a little bit about really how this program works in order to get the money. So the first year I talked about, which is the $21,000, what you need to do is you need to actually show that you have purchased new certified technology or you've upgraded your present vendor. A lot of software vendors and EHR vendors over the years have upgraded with adding features to make people eligible for this program. So again, the first year is all about showing that you have purchased or upgraded your software so it meets the certification. Then the next years after that, it's use something called meaningful use. Now you start jumping through a few more hoops. Okay, and we'll talk about that a little bit later. But really, you have to show how you use it. You have to show statistics for how many prescriptions you've written electronically. You have to talk about capturing problem lists. You have to show certain measures that you've done from your patients. So there's a lot of information that you need to, number one, capture during the visit to be eligible for the following years of meaningful use, and also to report to the government. So again, the second, third, fourth, fifth, and sixth years, you really have to jump through some hoops. But again, depending on the software, this could either be hard or easy for you. A lot of the questions I get are based around eligibility. So really, before you get a certified EHR and before you really look at the money you're getting, most folks want to know if I'm eligible. And so how do you truly determine this? Well, there's a few sets of requirements. I mean, obviously the government isn't going to make it simple for you to get money from them to get subsidies. So some of the requirements are, number one, you need to be a dentist. Okay, unfortunately, hygienists are not eligible for money, and I know there's a lot of argument that a lot of hygienists, especially in rural areas, do a lot of work that some dentists do. But at this point in time, dentists are the only ones that are eligible for the money. Hopefully that'll change over time. Actually, in the medical field, a physician can get the money, but also a nurse practitioner or a physician's assistant is eligible for the money. So if we draw the same analogy in dentistry, hopefully a hygienist will be able to get that money at some point. Then you have to show that you have done 30% or greater Medicaid visits in your practice or as an individual provider. The first year, you just need to show a 90-day period. But years after that, you need to show the whole year of 30% or more. Now, this is changing, and there's some legislation on the books that might bring it back to another 90-day period. But at the end of the day, the 30% or greater Medicaid visits is going to stay. And if you notice here, if you're a peds doc, you can actually lower it down to 20%. Okay, so that's where most of the dentists fit in, is this area. Not that most of them have Medicaid, but most of the Medicaid-based dentists are in private practice in this area. But let's talk about this point here. So actually, if you're a provider that works for a federally qualified health center, or you work for a community health center, they also look at sliding scales. Okay, and I don't want to get in detail of this, but let it be said that the 30% or greater Medicaid visits is eligible, or certain sliding scales if you're in public health are eligible. Okay, so that's really important. Now, what's the final thing? I keep talking about certified EHR. And that's what you need. Besides being a dentist, besides having the 30% or greater Medicaid or a sliding scale in FQHC or CHC, you must use the certified EHR, and we're going to be talking about that. So what is a certified EHR, and how do you select it? I've written quite a bit about this, and the thing that really concerns me in dentistry is that some vendors aren't really playing it fair. I wrote an article here for Dental Products Report called How Dental Professionals Can Avoid EHR Smoke and Mirror Sales Tactics. There are software vendors out there that are not quite giving the truth on how this whole program works, whether they're not giving the truth or whether they just don't understand it. There's a lot of salespeople out there trying to sell you on their software that it will make you eligible for this money, when in reality it might or might not. So you need to look at that. I also did a really interesting podcast on my site, Dental Software Advisor, what I call some software vendors taking a cheap and easy route to certification. And what I want to talk about really is what really constitutes what I call a true certified vendor. Okay, there are some vendors out there, again, that really aren't playing it straight, and you need to find a vendor that invests the resources, time, and money to truly have a real, what I call a real certified EHR. So here's some of the questions you might ask of your vendor if you're looking at to get a certified vendor. Are you certified under 2004 testing criteria? Now, this program I mentioned started in 2011. Okay, so there are vendors out there that were certified in 2011 when actually it was a little easier. However, to get the money moving forward at this point, you have to be certified under what's called the 2014 testing rules or testing criteria. So the first question to ask your vendor is, are you certified under 2014 testing criteria? The next thing, and this is where most of the confusion happens in our industry, in the dental industry, do you partner with medical EHR? There are some vendors I mentioned that actually take the time, money, and effort to put all the features, all the meaningful use features, all the certified features within their own software. On the other hand, there are vendors out there that took kind of, again, with the podcast we did on the cheap and easy route. Okay, so if I'm a software vendor, a dental software vendor, and I don't want to invest the time or energy, or I don't have the wherewithal to put all the features within my software, then what do? Well, there's plenty of medical EHRs that actually let you partner with them. Okay, so basically as a dentist, you would have your dental software, and then you would be capturing all the information for meaningful use for the incentive program to get the money with a medical EHR or a different EHR. Why is this a problem? Well, in this next item, I talk about capturing meaningful use in your workflow. So think about it. The dental software vendors that are incorporating all this work and incorporating all these features within their own software, well, then it fits into your workflow. If you have to capture information on you prescribing, problem lists, certain clinical decision support, information on smoking, wouldn't you rather capture it in your normal daily software instead of working daily in your visit with your dental software and then having to jump over to, let's say, a medical EHR to put the information? Okay, so really long term, you want to make sure that all the information you have to capture to make you eligible for the money actually is within your dental workflow and within your dental software. So ask the vendor and have them show you how you capture the information within the workflow of their software. The other thing is, on the back end, as I mentioned, there's a lot of reporting. There's reporting to the federal government, the state government, on what you've done. You actually have to show them. It's called attestation. Show them you did this, and you did this, and you captured this, A, B, and C. So what you want to do when you talk to your vendor, you want to find out if they provide you with reports that reflect what you need to attest to the government, or at the very least, allow you to pull that information out yourself easily. Because if you don't have that on the back end, you can capture all the information you want in your workflow, but if you can't report it out in your back end, then you're going to have trouble attesting to what the feds want in order for you to get your meaningful use money. Finally, I always want to know what the long-term commitment is. I've been doing this for a number of years, and like I said, when I first started medicine 5 years ago or so, 4 or 5 years ago, a lot of the vendors put just the minimum amount in, and I didn't know with my clients if they were dedicated to changing their software as this evolves, as rules and regulations evolve. It's a moving target. We've seen in the last 3 to 4 years of the program, it's at least changed 3 times in terms of rules and regulations. So what we want to know is this vendor, is your dental software vendor committed to investing long-term and making all the changes? And in fact, what I do besides selection and evaluation work, I do a lot of contract work on practice management and electronic health record systems with the vendors. And in all my contracts, I have a very large section, sometimes it takes a whole page, that I've developed over the years. And a lot of it is really about guaranteeing that you're going to make a commitment long term, guaranteeing that when rules and regulations change, if I get your software, that you're going to keep up with the Joneses, that you're going to change your software. So make sure that you get that long-term commitment. As I mentioned when we first started, I get a lot of questions. All the calls I get from dentists, sometimes on a daily basis now, they've been approached by different consultants or different companies saying that I'll get you the money. No problem, just trust me, I'll get the money. So the question is, do you need a consultant? And here's my thought. Bureaucratic paperwork. Okay, so you can always do it yourself. Okay, however, in Dr. Murphy's Law here that we're talking about, if anything can go wrong, it will. What I found from my experience working with federal and state government in the EHR Incentive and Meaningful Use program, there's a lot of back and forth. You send something online, they need more documentation. The numbers aren't exactly like they have in their computers, so you have to go back. So there's a lot of back and forth, and you have to deal with a lot of federal and state agencies. Okay, so a consultant certainly can do that for you. Again, you can do that yourself, but the question is, do you have the expertise and do you have the time? So perhaps that's where a consultant could help, is doing all this back and forth. That can take quite a bit of your energy and actually take some expertise because there's a lot of documentation needed along the way. The other thing I'll mention is that the only thing constant is change, as we have this quote here. What do we mean by that? Well, as I mentioned, in the last 3 to 4 years, this program has changed 3 times. So therefore, if you do have a consultant, one of the benefits of a good consultant is that they will keep up on the regulations. They will know what's changing because you might be eligible this year by doing ABC, and then next year it's ABC, D, X, and Y. So the question is, again, you can do it yourself, but are you going to keep up on all the federal regulations? A good consultant that's into this can help you with that. And the last thing I'll mention is because this flowed over for the medical world, there are definitely a lot of consulting firms that work strictly in medicine that said, hey, again, to my gold mine picture in the beginning, but there's a lot of money in dentistry. If you can find a consultant that really focuses on dentistry instead of medical and then dentistry as a side, that might be better because what's happening is I'm involved with a lot of things going on, a lot of committees and a lot of information flowing on this. And what I can tell you is that as the years go on, there'll be more dental-specific criteria. We don't have quite as much now as we would like, but that is going to change over time. So the more a consultant really understands dentistry, I think the better off you are. Finally, I want to talk about certified technology by itself. And this is really important. So even if you folks on this webinar are not eligible for the money from Medicaid, I think it's extremely important that as you move forward, as you look at software, you look at software vendors that are becoming certified. They're having their electronic health record technology certified by the government. And let me show you. I wrote an article in Dental Practice Management. I did it out of labor of love because had a lot of dentists coming up to me saying, well, you know what, I'm not really eligible, so why do I need certified software? And so it really struck me that an article was needed here to talk about, even if you're not eligible for the money, it's important to look at certified vendors. And this is just a subset of the information, but the thing is, I mentioned jumping through hoops earlier, jumping through hoops. What's that all about? Well, in order to be a, quote, certified vendor, the government requires that a dental EHR vendor, a dental software vendor, put certain features in their software, which actually at the end of the day, forgetting about the money and the reimbursement, is actually better for patient care and actually better for the practice. For example, one of them is they have a standard now for HIPAA-compliant communications. So a certified vendor has to really stick to what this is, has to standardize and include this in their software. There's the ability to do decision support, so you have problems and issues and diagnoses that you have in your patients. Decision support is really based on a problem, being able to make suggestions on how to treat. Now, they're not making you treat a certain way, but they're suggesting it, decision support. And this is very common in medicine. Hasn't really come about that much in dentistry, but it's really interesting because certified software is making this come to the fore of dental software. When I say coordination of care and interoperability, when you think about it, many times trying to deal with a case of a patient, you might deal with specialists, a general dentist might deal with a oral surgeon, might deal with a periodontist, you might even deal with a primary care physician or a cardiologist, right, on a case of a medically compromised patient. Well, again, being certified makes a dental software vendor use the standards that we're having for interoperability. In other words, passing information back and forth between electronic health records. So this will basically set the software vendor up for sending information to that oral surgeon's system or back to the hospital or back to the cardiologist or primary care physician. So coordination of care is something that's put into certified software. We're starting to see more advanced databases, and I don't want to talk about coding per se because there's a question about where we're going with coding in dentistry. But suffice it to say that there are more sophisticated coding bases, more granular and detailed coding bases that you will be using in your daily life, and especially as insurance changes and as accountable care changes. And so again, to be a certified vendor, you have to include these databases. Even if you don't have it now, you have to set yourself up for the future to include these databases. Another point is patient access to information. This is required to be a certified software vendor. To be able to have your patients be able to go into the software, be able to get information. In fact, it's a requirement of HIPAA now that a patient can access their information electronically. So what better way is it than having a patient go on the web and being able to pull that up themselves instead of you having to get it, send it, do whatever. It's a lot more difficult. Okay, so it's a pull versus a push. And these days, think about dealing with your physician. A lot of people go online, look at their records, look at the information, look at patient education. So patient access is a requirement of being certified. Finally, I say certified EHR is future enabled. What do I mean by that? Future enabled, that means that the companies that get their software certified, again, within their own software, put in features within their own workflow, these companies are ready for what's changing. We're changing dramatically. I mean, as I mentioned, I'm the Electronic Health Records Editor for Dental Products Report, and I do a lot of educational workshops. And I will tell you, the electronic health record technology is changing. Certified vendors are ready for that change. They're putting standards in there. So again, I really wanted to point out that irregardless of whether you're eligible for the money, it's probably important to look at certified vendors and see what they have to offer. Finally, we decided that this is so important, EHR incentives and meaningful use, that actually on my site, Dental Software Advisor, we started a section called the Meaningful Use Watch. And what we're going to try to do is we're going to try to keep up with all the regulations, all the information, what people do. We want to do case studies. So I really would encourage you to go to Dental Software Advisor and off and on check out our Meaningful Use section so you can be prepared for how this technology is changing. So I want to thank you, and again, the goal of this was to kind of give you some more information on how you can be ready and eligible for the EHR incentive and meaningful use program.